So if you look at the vocal cords themselves, they're basically two, what they look like strings strung across the voice box from the front to the back, and they're basically flaps. And so what they do is they come together and then they go apart. And when they come together, that's when you can produce sound. And when they come together, the airflow that comes below them basically pushes them apart and causes little ripples within the vocal cords, which then produces the vibration. And typically that's a fairly smooth set of ripples that's produced. And so you see this nice sort of symmetric wave that's set up by a constant airflow stream, which is the breathing out. When you have a rattling or sort of an inconsistent vibration, that's the crack. And so if there's some abnormality on the edge of the vocal cord, like a polyp or a cyst, or for that matter a scar band or something like that from previous injury, then the vocal cords can't set up a nice rhythmic vibration, and they have this asymmetric pattern which then causes a cracking of the voice. Basically, the vocal cords need to have a certain shape to them in order to vibrate properly. If you alter that shape, or you alter the ability of those vocal cords to move properly, you're going to alter that ability for them to produce sound. So for example, a polyp, which is a benign condition, can happen on the edge of the vocal cord. That's going to change the ability of those vocal cords to vibrate properly, and that's going to cause them to be hoarse. Similarly, a cyst, which is another benign condition that can happen on the vocal cords, will alter their ability to produce sound normally. I mentioned before scar tissue. Scar tissue is something that happens anywhere in the body, but it usually occurs after some type of injury. So if we scrape our skin heals, and you may have a little scar on the skin, and while it's a cosmetic issue, it really doesn't affect the function all that much. Whereas on the vocal cords, if you have a strip of scar or a band of scar on the vocal cords, it not only affects the appearance of the vocal cord, but affects function. So infections can occasionally cause it, but most of the time what ends up happening is that if you have an infection, like a viral infection, you'll cough a lot. And a cough is a fairly violent phenomenon when it comes to the vocal cords, because it basically has the vocal cords slamming together and then ripping apart. So if you have a fairly violent cough, you can oftentimes cause injuries to your vocal cords which don't heal properly, and may lead to scar tissue and long-term damage to the voice. We get oftentimes asked this question of, should a professional have their tonsils removed? Because a lot of professionals are worried about having any kind of surgery anywhere near their vocal cords, that it may change their ability to sing. That's actually been looked at, and the answer is that it may alter their voice temporarily in that they have to adjust to that sound. But there are muscles in the throat that can adjust the shape of the throat, and so they're able to work around it most of the time. There are occasionally times in which there are certain procedures that are done that alter their voice perceptibly, and that'll become a permanent issue. That tends to be more, for example, if you have a child or somebody who has really large adenoids, for example, that are obstructing their ability to breathe through their nose, well, they have a certain sound. It's probably not an ideal sound because their air can't flow through their nose. But if you take those adenoids out, all of a sudden they'll have a lot more flow through their nose, which will change the sound, and that's not going to be altered. Generally, that's better to have, and so patients who have really large adenoids, for example, we'll tell them early on probably to get them removed, and they can adjust to the sound of their voice. There are some patients who have very sort of characteristic sounds, and we'll see sometimes that they'll have some problems. You'll look down at their vocal cords or elsewhere in their throat, and you'll see something. But they have a sound to them that everybody knows them by. And so that's the last thing you want to do, is change that. And so sometimes you leave them with a little bit of problem because that's what they want to sound like. So a paralysis of the vocal cord can happen from an injury to the nerve. So obviously the vocal cords have nerves that connect to them that allow them to do what you need them to do, which is to move apart, come together, stretch, or relax. And those nerves can get damaged either through surgery. So oftentimes people have thyroid surgery, for example. Thyroid surgery, one of the risks of thyroid surgery is to end up with a paralyzed vocal cord. You can have another common surgery that can occasionally lead to a vocal cord paralysis is cervical spine fixation. So entry of the or placing a plate on the cervical spine through the front, because the front is where the nerves exist. So we oftentimes see patients who've had that kind of surgery and afterwards are hoarse, and we find that there's a vocal cord paralysis. You don't always have to have surgery to have a vocal cord paralysis. Occasionally what will happen is that if you get a bad virus, that particular virus can be what we call neurotropic, which means that it has the ability to get into the nerves and cause damage. And we will frequently see patients who come in after a bad upper respiratory infection, a virus, that will have vocal cord paralysis. And it can be anywhere from being a very, very hoarse, like a very breathy hoarseness, to almost normal, but having rasp to your voice.